Okay, so today I'm going to be starting a subcutaneous line on my client. So some indications for this would be that I need to give medications, and we could have some dysphagia or nothing by mouth. Another reason is we're going to have continual injections, and so we don't want to be constantly poking our client. So I'm going to come into the room. I'm going to introduce myself. Hi, Brooke. My name is Danica. I'll be your student nurse today. Can I please get you to identify your birth date for me? I'm going to check his wristband, check the birth date and the name. I'm going to check my policies and procedures manual per facility, and I'm going to go ahead and look at my doctor's order. So I have a doctor's order for morphine, 3 to 5 milligrams, IV or subcutaneous every 2 hours. So I'm not going to have an actual doctor's order to start the line, but it's just going to kind of be implied. I'm going to let my client know that I'm going to be starting the line on him. And so I'm going to get started, and I'm going to prime my tubing with my morphine. So I have my morphine here. I don't have a label on this one, but just for the purpose of this demonstration, I have morphine 10 milligrams per 1 milliliter. And I know that I have 0.96 milliliters in this tubing, so I'm going to prime the line with my morphine. So I'm going to wash my hands. When I get my morphine out, I'm going to, it's a narcotic, so I'm going to do my counts. I've counted 26. This is my 26th one. I'm going to now write that there's 25, and I'm going to sign that. I have a 3 milliliter syringe and a blunt fill filter needle to get my morph up here. Okay, so I have my syringe ready to drop my morphine. Just gonna open my equipment. And I also have my 24 gauge IV catheter, which I will be using for SUbcu. Okay, so I'm breaking away from myself, always keeping an eye on my morphine. I'm just gonna put it down. When I draw it up, I know that I'm going to be wasting 0.04 of morph, so I'm just gonna get my second nurse to check and initial that for me on my MAR. And she's going to watch me drop my morph. Sorry, just before I started that, just want to make sure that I get my syringe so it's not sticky. Okay, I'm going to put this in my sharps. And then I also just would have done the scoop method, so I don't have my needle sticking out. Okay, so I have nicely my 1 milliliter of morphine. So at this time I'm going to do my, done my first check, sorry. So I have morphine on my MAR. got my 10 milligrams per milliliter here. And I know that I have my morphine, 10 milligrams per milliliter. Okay, so I'm going to go ahead and prime my tubing. I don't need to pull back to get it out because, oops. Because I'm just going right into the tubing. That will go in sharps. Okay, and at this point I'm going to prime my tubing. I'm going to instill my morphine into my line. There's no air bubbles in it. I know that I have 0.04 milliliters in the blue cap here, and that's okay. Okay, and I'm just going to throw this into my sharps as well. And I'm going to document on my MAR that I have my 0.96 milliliters primed into my tubing. That's good. So at this point I'm ready to start my actual insertion of my catheter here. So I'm going to I could choose any of the rotation sites for subcutaneous that are appropriate. So we're just going to say Brock femur is a little bit confused, and we don't want him pulling or where he can see his catheter. So I'm just going to put it on the back of his arm. Make sure I have some nice subcutaneous tissue. Okay, I'm just sterilizing, sanitizing the skin here. I've got my chlorhexidine. I've gone in a circular motion. I'm going to let that dry. I could have donned my gloves on, my clean gloves. Okay, and I'm going to come in with my needle. I'm going to have the bevel up, and I'm going to come in at a 45-degree angle into the tissue. I'm going to pinch an inch and dart in. Okay, so at this point I am where I need to be. I'm going to vanish my needle, and I'm going to secure my my catheter here. Okay, and I want my window this way. So I want to see the site so I can assess the site. Okay, and I'm just going to apply firm but gentle pressure around. I'm not going to push directly on where the catheter actually is. Okay, at this point I'm going to connect my tubing. I know that I have morphine here, so I'm just going to be careful I'm not spilling. And I'm going to connect. Okay, so at this point I am happy happy with my where my catheter is. It's in place. I'm going to take my bigger strip and secure the top. I'm also going to secure the rest of my tubing down. Okay, so I've already made my med label a while back. I've dated the label, I have signed, and I have the concentration that was on the actual ampule. So it was morphine, 10 milligrams per milliliter, so I know that's exactly what I have in here. I'm going to fasten my label, making sure I don't cover the window. Of my site. Okay, and at this point I am ready to do my documentation. So I am going to date, time, and sign. I'm also going to have my 2 initials for my morphine, myself, and in my other documentation, I'm going to put where I actually put it, which site it was, how my client tolerated the procedure, and yes, thank you.